In terms of transport and access, there's a focus on the long-term plan on moving to a safe transport network free from deaths and serious injuries, and we believe our work aligns well with that. Next slide, please. Thanks, Mark. So a little on who we are and what we do. There are approximately 20 organisations making up the Safety Collective. 5 are represented here today. 6, including ACC. There are 9 who have joined the collective since accreditation was obtained last year. We're led by, or chaired by Councillor Falpena, and we want to acknowledge your proactive leadership of the collective, Councillor. Essentially, the collective identifies injury prevention priorities for Tamaki Makaurau using the available evidence. It shares information and strategies for addressing this injury harm. We have a website that will go live later this year to promote the strategies, the actions we are looking to take and influence, and to seek even more engagement. And thirdly, we support and advocate interventions at a community level. Be those by local boards, community groups, or indeed the governing group. So just expanding on the last point there, we use a collective impact operating model. That is, we seek to influence outcomes through things such as guiding vision and strategy, supporting aligned activities, improving the use of data, building public awareness, advancing policy and mobilising funding. It's important to note, therefore, that the collective is not a delivery agency. Its work is supported by myself and a part-time data analyst. We are employed and supported by council, but funded by ACC for 3 years under an agreement between ACC and council. ACC itself is an active member of the collective, and in fact, Richard, who's in the gallery today, has been leading the planning work around falls prevention and our strategy. And during this year, we agreed to a strategic plan. I appreciate you won't be able to read that, but you do have a copy in your attached with your papers. So our focus for the next 2 years is on the harm caused by alcohol, transport and falls across Tamaki Makaurau. A 4th element is around improving our capacity and capability. And we've left open the possibility of picking up or addressing new or emerging issues if appropriate. So examples of the sorts of outcomes we're seeking are reducing the inequities in hazardous drinking and harm, especially between Māori and non-Māori, reducing DSIs, or deaths or serious injuries, across the transport system, and reducing the rate of falls and hip fractures, particularly amongst the older population, but also the rate of falls-related injuries for children, particularly on playground equipment. So as those examples might demonstrate, it's important to stress that the collective brings an equity lens to its work, as we're aware that injury harm falls disproportionately on communities that have got significant lower socio-economic populations and Māori and Pacifica, as we'll demonstrate in the following slides. So now I'd like to hand you over to the members of the collective for more information on the harms that we're trying to address and some initiatives we have or soon will have underway. Starting with Nikki.
Kia ora. Well, you'll all be well aware of the harms from alcohol because your commitment to the local alcohol policy is outstanding. And I hope that we have success in this process. So what we've got on the next slide, please, is really just a snapshot of just some of the harms. Certainly hazardous drinking is a pattern of drinking that increases the risk of physical and mental health harm. Although the 3 DHBs have a lower prevalence of hazardous drinking than the national average, that's because we have a high number of abstainers across the region. So this is masking differences by ethnicity and by income. So despite our lower prevalence of hazardous drinking, we actually meet the national average of hospital admissions due to alcohol. So there's something going on there that those that are drinking are experiencing significant levels of harm. And it's not just a young person's issue, it's increasingly my age group, 44 to 65, 65 and older, turning up to our EDs and our hospitals. And here are our linkages with transport. We know that more than 1/3 of the deaths in Tamaki Makaurau are due to alcohol, and about 1 in 5 deaths and serious injuries attributed to alcohol, related to alcohol. So this is a whole of council issue, from licensing through to parks, through to advertising, through to signage, through to local alcohol policies, availability. It's really in your control. And so as part of the Tamaki Safety Collective, we are contributing to the review of the whole of council plan around alcohol to make sure that we're all on the same page and we're all trying to achieve the same outcomes in relation to reducing alcohol-related harm. Obviously, there's a really important opportunity that exists right now in terms of the signage bylaw review to really prevent the safety issues around alcohol advertising at shop fronts and also the community amenity effects from bottle stores being saturated with branding and advertising. And finally, one of the pieces of work we've been doing is with KAD, Community Action on Youth and Drugs, trying to ensure that schools are adopting evidence-based practice when it comes to alcohol and drug education, because the global alcohol companies are well and truly in our schools right now, teaching our kids about alcohol harm. And so we've been trying to actively communicate to the schools about the resources such as Tuturu, which are available for a whole-of-school approach to reduce inequities of harm that meet the needs of our students, programs that are designed in Aotearoa, New Zealand. Kia ora.
Kia ora, Nikki. I'll now take us through the transport slide on here. So what's highlighted on here, I suppose, won't be anything new for those around the table. Transport safety is a big issue within the Auckland region, and what we've highlighted on here is just a couple of key stats that we see through our crash analysis system. So we see an overrepresentation of Māori and Pacifica people, and also that big number there of 49% of our deaths or serious injuries on the network are people walking, cycling or motorcycling, so people without a big metal cage around them. A couple of initiatives that we are supporting through the Safety Collective is lining up with the Vision Zero for Tamaki Makaurau strategy and action plan. So we're not doubling up on the work that's happening in that space, we're just broadening the support and the groups that are focusing around that. This includes things like the Te Ara Heipapa community road safety program, things like the changes to the speed limits, and advocating for a review of financial penalties and fines for road safety related offences. The next thing on there is supporting the funding allocation of the rollout of school speed zones. We've got a great signal from central government through Road to Zero around wanting 100% of schools to have a safe zone outside them. To achieve that currently would take a third of our road safety budget, and it does not achieve the reduction in DSI that we would otherwise achieve through that budget. So we're wanting this to be on top of, not instead of. And then the third one there is around identifying and supporting investment into programs that address the uptake and achievement of driver licensing for Māori and Pacifica peoples for lots of reasons, to help better engage in the workforce and communities and to be less disproportionately affected by the fines and penalties and the getting into the justice system through that as well. So yeah, it's kind of pulling together and ensuring that we are getting the collective support for these initiatives.
Next slide, please. So I'm going to go through the reducing falls harms. Falls or fall-related injuries account for nearly half of all hospitalizations or injury hospitalizations for both adults and children. It's also a leading cause of death for over the 65-year-olds. For children, a third of fall-related injuries are due to playground equipment falls, both inside and outside the home. We estimate that around 80 kids in the Auckland region are hospitalised as a result of these injuries. When I'm talking about hospitalisations, we're talking about kids who have been admitted at least 24 hours or more. We're not talking about the bumps and bruises, those who are admitted to ED, A&E and GP clinics. From the body of evidence that we know that there are two main groups that are most at risk, those in highly deprived areas and children aged 5 to 9. So some of the initiatives that we are wanting to promote, first is for fall-related injuries, promote improved active transport and options for physical well-being. We're wanting to explore barriers that older people face to attend community strength and balance classes. And thirdly, influencing approaches to design standards where this could impact on the rate of playground injuries. And we already started that work in conversation with Parks and Recreation, learning about how injuries are logged, looking at maintenance programs and taking the learnings from that to try and provide evidence to reduce playground injuries in our Tamaki Makaurau. Thank you.
Thank you, Moses. Next slide, please, Mark.
Just quickly on Hapoi Te Hora, for those who don't know who we are the largest Māori public health organisation in the country. We are owned jointly by Ngāti Whātua, Tainui and Te Whānau Waipareira. They do get on occasionally. And we joined this collective because their goals very much align with ours. In particular, we saw the opportunity to tackle some of the many inequities faced by our communities. In particular, the ones that you see up there. There's no reason that Māori should be overrepresented in a lot of these stats, particularly if you can see them up there, the death and serious injuries, DSIs for short, but in Otara, Papatoetoe, 25% of those DSIs involve Māori, who are only 16% of the local board population, and you see the same theme running throughout. In particular, we are focusing on the alcohol harm faced by our communities and the disproportionate harms there. Yeah, once again, that's up there, and I think everyone has probably heard these many times from Nikki. From here, I'll pass it on to my friend from New Zealand Police. Kia ora.
Part of the police strategy in our business is to have these goals, and our goals are to have safe homes, roads and communities. So we are committed to looking for every opportunity to prevent harm, and we have a prevention first model. So we're not just responding to incidents, but actually using evidence-based policing to make sure that our communities are actually safer. So we recognise that in order to do this, that we actually need to be part of partnerships such as Safety Collective. And so we're doing this because we can't create a safe community on our own. We recognise that we need to be part of the Safety Collective in order to deliver safe outcomes for our people and make New Zealand the safest country.
Thank you, Tony, and thank you, colleagues. Just in summary, if we could. Of course, just the last slide. Oh, thank you, Welia. Thank you, team, for that exposition. So, in short, the Safety Collective Tamaki Makaurau has set a strategic plan for 2022 that we believe is aligned with key Auckland Plan goals. Our focus is addressing inequities in injury outcomes across the three areas that we've described. We're not a frontline service delivery collective. Our activities seek to influence outcomes. And I hope we've been able to give you some examples of the challenges we face and intend to address as we do that. Thank you, and I'm happy to take any questions.
Ngā mihi ki a koutou katoa to our whānau. So look, thank you so much for this. I know the work, and I know Councillor Collins as well. That was part of it in the last term, knows the work that you as a collective do. So just want to acknowledge that. I've got two questions or comments. So Councillor Henderson, you're first.
Thanks, Matua. Great to see you. I know Safer West has produced amazing results since '99, so thank you for that. Just picking up on the slide on alcohol harm, there are some very useful stats in there on hazardous drinking by DHB. Now, we have a regime in West Auckland on handling alcohol supply that is focused strongly on harm minimisation. So the stats on Waitemata DHB is very encouraging evidence that it's actually working. But despite this, Waitemata is a pretty huge area. So is it possible to break it down further by, say, ward or area of Auckland?
Kia ora, I have to acknowledge that I am a resident of West Auckland, so and have my own views. So yes, we can break it into local board areas and look at hospital admissions, but because the numbers are so small, we usually need to use rolling averages of at least 3 to 4 years of data to do that. the thing about trying to empirically examine the impact of the trust is you need a really robust method. And it's not just about comparing a community with similar characteristics. There's a whole range of factors that go on. And I think the question, I spoke to a journalist yesterday on this very issue, was in fact the question is what would West Auckland look like without the trust model? And I don't foresee a relevant comparison that might work for West Auckland. You have to realise that the trusts still sell the cheapest alcohol in the country through their Pack and Save outlet. And I have that in my office back in Newmarket. And there are still, concerns. Availability is lower. I absolutely acknowledge that.
Thank you. So basically it's about comparing socioeconomic apples with apples.
Not just socioeconomic,
Right.
but age profiles, ethnicity profiles. Also, I think we can't underestimate the impact of wider social norms, cultures of drinkings in particular areas, and how we take that into account when we're analysing studies,
Cool.
even things like religion.
Thank you. Very useful. Cheers.
Ka pai, and Councillor Casey.
Yeah, thanks, Alfie. I'm really glad that Auckland Council's a partner in this august body of professionals committed to reducing harm. And I'm also glad that you have a strong evidence base. And as you may or may not know, we had a lengthy discussion the other day at the Regulatory Committee on alcohol signage. And since you're here, I wouldn't mind hearing just a quick 2 minutes on whether you think there is an impact with regard to sign alcohol.
Point of order, Mr. Chair.
Alcohol.
Well, I'm sorry, point of order. Because there is a process for this to be heard in the bylaw, we actually declined several groups who wanted to come and speak at the Regulatory Committee for that reason, understanding orders, and I think it's a little bit unfair now to then allow this group around the houses to do it that way. It's not fair on all the other people that we declined, including local boards, because we will have a full public consultation process.
Yeah, no, look, I agree, and I didn't know it was coming. So, look, thank you. I'll go to Councillor Cashmore.
Thanks for your indulgence, Mr. Chair. Also to you, Nicky, you mentioned our local alcohol policy, and you know we went through a pretty strong, lengthy and comprehensive process to reduce alcohol rate at home, but also to have a balance with the hospitality industry. We think we landed in a pretty good place. We're now just landing in court case after court case. It's been dragging on for, I think, 3 years. Well, it's okay. Put it down to my grey hair and forgetfulness. I firmly believe personally there needs to be legislation change around the endless legal mechanisms of basically the retail industry. And would your group be in support of us going to the new government, whichever one it is, to say, hey, this is not working? A lot of councils have pulled out of the appeals, LAP process because of the legal cost. So we would really like some support from some people on that if we're going to have a challenge of that.
And absolutely. Depending on how the Saturday goes, there has been indication from at least from the Labour government that this issue would be in consideration, potentially not 2021, but maybe the year after. Certainly, a number of MPs I have spoken to are cognizant of this issue. Whether getting rid of the appeals process would sort it out, I don't know, because we'd still end up in judicial review through the High Court. So I don't know what the answer is, but given that, gambling policies and other social policies don't have this appeals element, I think it needs to be looked at. If it's not going to be devolved to local government, we get those regulations into national legislation so they're the same for everybody, and that may be the alternative. But it is on the cards. MPs are well aware of this. Only one council has not been through this legal appeals process.
Councillor Hills, you are the last person for questions and comments, and then we'll move through the agenda. Thank you.
Good, thank you, Chair. Thank you all for the work you do and the important work you do for our communities. The question I have, and it's based on the Youth 2000 and that data over the last every 7 years, which has shown a dramatic drop in binge drinking, drug use and tobacco use by young people, which is great news. But I heard a comment before around hospital admissions around that older than young, in 30s and 40s. A lot of the stereotypes and probably promotion still is around alcohol and drugs affecting mostly young people, which in the stats is showing it's just not true. So what kind of work are you doing in the area, or what can we do to help bring that message? It's clearly an issue in a different age group than we're actually talking about.
It was the topic of my PhD, so I could probably talk all day about it. In the 2019 data that came out last month around binge drinking, you're right, we had gone from about 43% down to about 34%, down to 29%, and now we're about 22% of all students from 13 through to 19 participate in binge drinking at least once a month. So we're starting to plateau. So we're still about 1 in 5, which is still too high, I would suggest. So we've still got a way to go. But what we have seen since 2012 is a significant increase, not just in New Zealand, but in other countries, a significant increase in those 25 to 34, 45 to 54, and 54 above. There has been a rapid increase in hazardous drinking in that age group. It's my group that hasn't stopped their hazardous drinking, they've just continued it through every age group. And I think we do need to say the majority of hazardous drinkers in New Zealand are in my kind of age group. They're not in the young adults. They have a higher risk, they have a higher proportion of binge drinking, but the vast number of us are in this age group. And we do have to change that discourse. The issue is, though, that those 18 to 24-year-olds are still very, very high prevalence of hazardous drinking. They're still up in the 40%. So we've got a long way to go. We've got adolescents who are decreasing those behaviours, and the moment they turn 18 is entering an environment that is incredibly risky for them. So we've got that transition is really important that we need to look at.
Kapai. So I've been monitoring our chat on Skype. So Councillor Collins, you have a comment, and then Councillor Casey, you will move, and Councillor Collins will second. So Councillor Collins.
Thank you, Chair, and my apologies that I'm not there to be able to see the presenters, but I just wanted to add my thanks to Wayne and the team. It's good to see them again. I had the honour of working with the Safety Collective last term, and I found them to be a group of people who continue to show a level of passion and commitment to the community to really make a difference. And I learned very quickly that this wasn't about us making a difference on the ground immediately as the team, but really pulling the influences and the movers and shakers together so that differences could be made on a much wider scale. So well done to you, Chair Filipaina, because I know that you're working with the group now, but I just wanted to offer my thanks because I still get updates from what the collective is up to, and I really value their work. So thanks for the chance to make that comment.
Yeah, whakatau lava, lawa whionga, thank you. So look, to the collective again, and I've said this earlier, thank you for the mahi that you do, and that you will continue to do. So it has been moved and it has been seconded. I will put the motion. All those in favour? Aye. Against?
Aye.
Carried. Thank you. Enjoy the rest of your day.